My name is Crystal Arvey, and I found Dr. Posh online on a Facebook group. I actually researched him because I wanted to get my tummy tuck because I was losing weight and I was done having children, and with losing the weight, my stomach wasn't going anywhere. So I was like, okay, I have to do something to, to get that flat stomach. And so I started researching, looking for a doctor, found him on a Facebook group and called the office, made an appointment, met with the staff, met with him, and I instantly fell in love. I had a good vibe, and I knew that that was going to be the doctor for me to do the surgery. My sister-in-law actually had a tummy tuck done in Tennessee. So I talked to her about her experience and everything. And then I did go online, went on YouTube, went on different other websites, looking at the procedure and before and after pictures. So I kind of had a pretty good high level of what I was getting myself into. I actually had a tummy tuck, liposuction, and a breast lift. First off, coming in, the front staff, they were great, welcoming, clean. So just aesthetics, that was very appealing. And then when I met with the doctor, he was very warm, hilarious. He just made me feel really comfortable. He went over things in detail with me, had me to, he showed me, I stood in the mirror. He said, I think you should do this. He was very honest. And so I felt comfortable that he wasn't just trying to get me to do procedures that I didn't need. One of the things that really sticks out to me was after I left, I had tons of questions. I mean, when you're in the consultation, you can't think of everything. And so I actually sent an email back to the office the next day, and the office staff called me and actually put the doctor on the phone. And that to me was a selling point with Dr. Posh. I expected his nurse or the front staff to answer the questions. He literally went line by line on the email answering those questions, and I felt definitely comfortable prior to my surgery with that. I had the tummy tuck, the liposuction, and the breast lift. So my recovery was all at once. He was very detailed with letting me know what to expect. He's very meticulous. That first week of recovery was probably the hardest one. I had to walk bent over. He didn't want me to put any pressure on my abdomen, but I knew it was for the greater good, and I'm pleased with my results. I would say I felt normal, felt more like myself probably after about a week, as far as feeling, like I could move around even more. But I really felt probably about 2.5 weeks after I got those all of my drain bags taken off. That's when I really felt more like myself. I mean, the surgery is just the first part of it. The recovery part is just as important as the surgery. You definitely want to have some good help because you're not going to be able to be very mobile, definitely those first few days. So you want to have help around the house to help you with if you have the kids or whatever, food cooked, frozen, so you don't have to do as much. But definitely all those little things, getting those massages and making sure that you are massaging your scars to minimize scar tissue, other things. Being really careful when you have those drain bags. I mean, it's a pain, not literally pain, but it's necessary. It's not the most ideal, but you definitely want to keep those drain bags in as long as the doctor recommends it, because you don't want him to have to go in to drain out any excessive fluid. And just making sure you're doing those, the things that he tells you to do, drinking your water, getting up, walking around. That's going to help in aiding that recovery. But if you do all of those things, I think you'll be pleased and you'll be happy.